Now at 5:30, the COVID counterattack.
We know that the vaccine works.
But will our community reach herd immunity?
And this really is an individual decision.
Tonight, 10 TV will explore the hurdles we still face.
I think that medical advice is hijacked by social media.
And the challenges magnified by the pandemic.
There are a lot of structural barriers the communities of color are facing.
As we continue to navigate this new life.
Can you be brave for 5 seconds?
And find new pressure points.
Public health experts are scientists. They are not politicians.
We know one thing is permanent.
This virus is not going away.
Well, thank you for joining us for a 10 TV special half hour. I'm Yolanda Harris.
And I'm Andrew Kinsey. We have a half hour special here with the COVID-19 booster and the efforts here to control the virus here in Central Ohio.
Now, it is a new phase of this pandemic with some brand new problems. We're going to talk about breakthrough cases, boosters, and of course, vaccines for kids.
That is why we have 10 TV team coverage tonight. Our Lindsay Mills will talk with an infectious disease expert after vaccinations.
And Kevin Landers sitting down with 3 doctors in Central Ohio to ask where our community still needs to go. Plus, Bryant Somerville talking to 2 families, one getting the vaccine, the other not. 10 TV talked to 6 medical experts, all from 5 different health agencies here in Central Ohio. Ahead at 5:45, we'll speak live with 2 doctors from the Ohio State Wexner Medical Center. So send your vaccine questions now to 614-460-3345. We'll answer them live in just a few minutes.
But first, let's take a look at where Ohio stands right now for vaccination rates. Overall, we are at 56.9% of all Ohioans that have at least 1 dose of that COVID-19 vaccine. Here in Franklin County, just over 61% of people are vaccinated. Health experts say we need to get to 70% to help reduce the spread of the virus. Right now, there is only one county in the entire state over 70%, and that's Delaware County.
Health experts say one group that could get us to that COVID-19 immunity finish line would be our children. Some parents across Ohio are still weighing the pros and cons of giving kids the COVID-19 vaccine. Tonight, 10 TV's Bryant Somerville talks with 2 parents about why they are or are not rolling up their sleeves.
Can you be brave for 5 seconds?
Every parent knows that feeling.
Yeah, you could come sit on my lap.
That feeling of being totally helpless.
If you're not ready, take a deep breath. Can you turn around?
Karen Nickel is getting her COVID vaccine booster. She's going first, holding her 7-year-old daughter Cora's hand, showing her it's not that bad. Cora, now eligible for the vaccine,
Take a deep breath and show us how brave you are. Ready?
is getting her first shot. And to Mom's delight,
She did.
with little to no fight. Getting the vaccine a no-brainer for their family.
And it was important because there's lots of people that we know and love, friends and family who are immunocompromised and, you know, people that we want to be around, and I feel more confident being around them if we are protected so we can help protect them.
But not every parent is rushing to the front of the vaccine line.
In your household, we're not doing it.
Pretty much.
Julie Joseph is a mother of 2 and a grandmother to a 5-year-old grandson. She's not against those who decide to get the vaccine. She says that understanding and acceptance is not returned.
In this society, it's almost impossible to not be attacked in such a manner.
She's not against the vaccine. She is, however, more skeptical of the younger side of that new 5 to 11 age range. Even with health professionals saying the vaccine is safe, Joseph thinks it came out too quick and questions its safety.
Something just tells me to leave it and not to trust it. I know that sounds really, really odd to most people. But I also talk to people who I know who have had the vaccine. I know people who've had issues since they've had the vaccine.
Every parent knows that feeling of being totally helpless.
Look at that. I can't believe how good you did.
But parents on both sides of this conversation, backed by experts and opinions or gut feelings, are doing what they believe is best for their families. Bryant Somerville, 10 TV News.
And just a reminder here, if your child is vaccinated, the deadline to enter that Vax to School program is this Sunday. Ohio is giving more than 150 scholarships away to kids that are vaccinated. Kids as young as 5 are eligible.
It's been more than 300 days since Ohio began vaccinating people for COVID-19. Since then, doctors have been battling a minefield of misinformation. So 10 TV sat down with 3 doctors, Dr. Joe Gastaldo, Mark Herbert, and Dane Snyder, for a roundtable discussion, all 3 from different local hospitals. Here's 10 TV's Kevin Landers.
When it comes to the COVID-19 vaccine, a little more than half of Ohio is fully vaccinated. We asked 3 experts about what that number means to them.
If you look at ages 12 and over, the vaccine rate, at least starting, is in the 70 percentile, 80 percentile range. So I think that's encouraging, at least for Central Ohio.
We're seeing a lot of motivation by parents to have their children vaccinated now that they have this new tool that hasn't been available to them. And
statewide, 52% of Ohioans are fully vaccinated. 56% have started their first dose. As a state, we rank 29th in doses administered.
Do you think we'll be over 60% by the end of this year, fully immunized?
I don't think so. I don't think we'll be over 60% all in all for the whole state. I'm hopeful that we continue to gradually move in the right direction.
All 3 doctors say a barrage of misinformation about the vaccine on social media has sown confusion among the unvaccinated.
I think the main reason behind that is that the information out there, you aren't sure what to believe. So I have friends and family and families in my offices who ask me, what do I believe? They see opposite information about this particular vaccine that they haven't seen before.
Politics has given permission to social media to spread misinformation.
Doctors say they continue to try to counsel patients to get the shot, but many patients, they say, are convinced they don't need it.
Most individuals have already made up their mind about the vaccine, and they just want to engage in an argument. So personally, I don't spend as much time as I used to talking to people about vaccine.
A great example of that is ivermectin and hydroxychloroquine. There are still medical professionals on social media touting these miracle cures, these miracle drugs. And it's very easy for people to go on social media and believe that.
Anything that you put into your body has the potential to have a small amount of risk. I think we need to be transparent about that, but the risk is so small.
Dr. Gastaldo admits with any new virus, information changes, and every time doctors come out with a new recommendation, he says, he understands how that can lead to confusion.
We are building the plane as we fly it, meaning that as new information comes out, as we learn more, things are going to change. And that can be confusing for the public to understand.
The bottom line, they say, is that the vaccine is safe, and without a mandate, these doctors believe getting the shot can be the difference for some between life and death.
The way to learn to live safely with this virus is through immunity. The safest way to get that is through vaccines. Those are the safest tools we have.
Kids have a lower chance of having severe disease, but they do. 8,500 kids have been hospitalized.
I've seen well over 1,000 people in the hospital with COVID infection, and I've seen dozens of people die. None of them wanted to have COVID, and none of the people who died wanted to die from COVID. And it's a preventable disease.
Kevin Landers, 10 TV News.
For the last year, the pandemic has magnified gaps within the healthcare communities for color.
Well, just last week, the Biden administration announced a $785 million investment to help close those gaps. It's called the American Rescue Plan. Now, the goal is to boost access to the COVID-19 vaccine and build vaccine confidence across the United States. So where does Ohio stand right now?
Over time, we have seen the gaps narrow. We have seen an increase in the Black and Hispanic vaccination rates, particularly in the Hispanic vaccination rates over time. The gaps are nearly closing between the white and Hispanic population.
Nambi Ndaga is a policy analyst at Kaiser Family Foundation, an organization tracking health disparities across the country. She says throughout this pandemic, the 2 big obstacles for minority communities are language barriers and accessibility. So 10 TV looked directly at the city of Columbus.
Yeah, according to the Columbus Public Health, about 56% of residents in the capital city are fully vaccinated. But health leaders like Public Health Commissioner Mashika Roberts says the goal here is to get over 70%. She says one program helped narrow gaps in our communities of color.
When we looked at communities who are socially vulnerable, so those are usually communities of color, low-income communities, they did not have the vaccine uptake as those who had a low social vulnerable index score. And so by the Vax for Cash program, we've definitely narrowed that gap.
Yeah, we got more details on that. According to Public Health, the city of Columbus has given out 21,000 gift cards to date and spent over $2.2 million on Vax Cash program since it was launched. And hospital leaders have a plan to increase access for communities of color as well.
That's right. Coming up next, 10 TV is talking live with doctors at OSU Medical Center to outline that plan and answer your vaccine questions.
All right, continue our team coverage tonight. We want to ask your COVID-19 questions to our team of experts.
We have two doctors with Ohio State Wexner Medical Center who are joining us live now. Dr. Ian Gonzenhauser and Dr. Sophie Tolliver. Thank you both for joining us tonight.
Of course.
Thank you for having us.
Great. Our first question sent to 10 TV is for Dr. Gonzenhauser. And doctor, there are a lot of questions about whether someone qualifies to get a COVID-19 booster shot. What are the qualifications you give patients when it comes to getting boosters?
Yeah, this is a great question, and I'm so glad it's being asked because we really want to encourage people to get out there and get their booster shots. A little bit of confusion in this space right now, and I think we'll get the green light shortly nationally for really everybody to be eligible for boosters. But the secret right now, kind of the confusion right now, is that more people are eligible right now than they realize. There are a host of comorbid conditions that qualify you as high risk and qualify you to get the booster. These are things like type 2 diabetes, asthma, heart conditions, including hypertension, obesity, mood disorders like depression, smoking, substance use, history of stroke, many, many more. So the vast majority of people already qualify for boosters and should go out there and get them.
Yeah, Dr. Gonzenhauser, even with that booster or even a 2-dose vaccine, should people still wear a mask inside during the holiday season? And do you expect a holiday surge with more people inside?
Yeah, big question as we approach the holidays, both Thanksgiving and the holidays that will come after. Unfortunately, while we expect to see a bit of a surge after any major holidays, what we're worried about right now is that we're starting to see that uptick already, maybe as a result of Halloween, maybe for other reasons. So we certainly expect that we will see some surge after the holidays, but we're hoping that it's minimal. The things that people can do to minimize the chance of that surge is pay attention to who you're going to be around, who you will be celebrating with, what the environment is. That really determines whether or not you need to be taking precautions. If you're in an environment where you are vaccinated and everybody that you are with is vaccinated, you can have a pretty normal celebration. If there are going to be people who are not vaccinated with you or high-risk individuals, that's when you want to start thinking about wearing masks, physical distancing, potentially even spreading out your celebration or doing it in an out-of-doors area if that's at all possible.
Okay. Dr. Tolliver, this question is for you. When it comes to vaccine distribution in our communities of color, statistics show the gaps between race and ethnicities are narrowing here in the Buckeye State. What are you seeing, and what has shown proven success to help narrow those gaps?
So thank you for having me again. So in my personal experience and in my own clinic, we are seeing a wide breadth and depth of diversity of people and communities, including communities of color, coming in to get the vaccine, whether it's the first vaccine, the second vaccine, or the booster. Our slots are very busy. Our clinic vaccine schedule is very busy. So absolutely, we are seeing people come in, and I'm even seeing some of my diehard skeptic patients who at the beginning of the pandemic were not really wanting to get that vaccine. They're starting to come around. Those conversations are evolving. They're asking more information. And I'm happy to say, I've given out some vaccinations in the past week.
Dr. Tolliver, viewer Abby asking right now, when you have a breakthrough case, how soon should you get the booster? And does this mean you have no more immunity since you've gotten a breakthrough case?
Wow, what a great question, Abby. So if you have been exposed to COVID-19 and have a COVID-19 breakthrough infection, as far as the data goes and the information and the guidance goes, you should wait that 90 days to get your vaccination. And I don't know if there's a lot of information about immunity being lost. My colleague might have more information about that, but I do believe that's the recommendation.
Dr. G?
Yeah, that's absolutely right. You know, if you have a breakthrough infection, the recommendation right now is to wait 3 months before your follow-up vaccination or your booster dose. That may change as things move forward. One of the reasons for that early on was to preserve the supply of booster doses. So we may see that guidance change, but as for the moment, that's what stands.
All right. Thank you so much for clearing some things up and answering our questions here tonight. Thank you both, Dr. Gonsenhauser and Dr. Tolliver.
Thank you.
At this point in the pandemic, you may know someone who experienced a breakthrough case of COVID-19, which means getting infected with the virus after being fully vaccinated.
10 TV's Lindsay Mills spoke to 3 vaccinated Ohioans who say testing positive brought anxiety, anger, and guilt.
Jennifer Hall, a teacher in Butler County, was eager to return to work after a year at home going through treatment for breast cancer.
I'm finding it hard not to be angry.
Not long after getting back to work this school year,
I thought I was doing everything I possibly could to minimize the risks.
she tested positive for COVID.
I am just so disappointed that we haven't stepped up and eradicated this virus when we had the chance.
All those things run through your head about, how do I really feel? Do I really feel sick, or is this just my head messing with me?
John Cameron, a father, had a breakthrough case during the Delta surge. He was worried about passing the virus on to his kids, ages 9 and 11.
I still can't really smell 100%.
I somehow managed to catch it.
And Lisa Stone, a mom in Mansfield, says she got vaccinated as soon as she could because she has a compromised immune system.
I was really upset that I somehow managed to catch it, and I had no idea where.
3 different people with what experts call a post-vaccination infection. While their experiences were different, they all agree on this.
It would have been a hell of a lot worse if I wasn't vaccinated.
Ohio Health's Dr. Joe Gastaldo says there's truth to that.
If somebody has a post-vaccination infection because their antibody levels are lower, guess what? You got your memory cells that are going to ramp up. You're going to have your antibody titers come up a lot quicker, and you're going to really clear the virus a lot quicker.
According to the CDC, the risk of hospitalization and death is much lower for fully vaccinated people. Right now, the CDC is leading multiple studies and monitoring breakthrough cases to identify any potential trends with age of people infected, whether they have underlying medical conditions, if a specific variant caused a breakthrough, and what brand of vaccine someone with a breakthrough case received.
So we really need to have good transmission studies with COVID-19 in those who are fully vaccinated.
I had every symptom.
Jennifer Hall, who experienced a breakthrough case,
but not for very long,
will pay close attention to see what that research reveals. While we all wait for that research to determine what the risk is for spreading the virus among vaccinated people, experts say getting vaccinated is the best way to protect against infection and transmission. Lindsay Mills, 10 TV News.
10 TV is making it easy for you to find information on COVID-19.
You can find all of these stories on our website, 10tv.com/coronavirus.